Mary Washington has been the main healthcare provider for over 110 years in our community. The mission of Mary Washington Healthcare is to improve the health of the people in the communities that we serve. And VHVI targets the heart and vascular care.
Virginia Heart and Vascular Institute, it's an organization that brings together the various disciplines within the medical community that are directly involved in cardiovascular care.
All the doctors work together towards the same goal so we can provide the best heart and vascular care for the patients.
The benefit to the patient is really better care, more efficient care, and really a coming together of the minds to really deliver a better product.
Doing all that seems very easy, but to be able to provide that kind of outcomes and reporting requires a group effort. And that's where VHVI comes in to really provide that comprehensive effort at providing all these services, providing them in a manner that really helps the community.
VHVI is part of the broader healthcare system in Mary Washington Healthcare, where we are just one of the centers of excellence. We have the Women's Health Institute, the Regional Cancer Center, the Human Motion Institute, we have the Neurosciences Center. Our physicians are collaborating across centers of excellence to provide gender-specific care, to provide the best health care for the patients in our community.
I think women as nurturers are taught to take care of their families and their husband, and so they kind of put their health on the back burner. And at some point in time, maybe you don't have to wait till you're 75 years old to say, hey, this is about me and I need to take care of me. I need to stand up for me. Didn't know I had heart disease, found out in a strange way. He had had some tests with a cardiologist and we went in for the results. And his results were good, and Warren said, would it be a good idea for Ann at her age to have these tests also? And he said, yeah, it would be a good idea.
We were expecting everything to come up beautifully, and came back and he said, you're going to have surgery.
I had 3 blockages that they could see. Possibly they would do a triple, possibly a quadruple bypass, which is what they did. I couldn't say enough good things about the care. Between Dr. Naw and his staff, they all put me, both of us and my family, at a comfort level that we felt good about. It was like, okay, he's gonna make it all better. And he did. All of us, maybe particularly women, we need to be our own advocate. We have to take responsibility for ourselves, for our health, for taking good care of ourselves. Not only the other people that we love, but ourselves. And nobody else is going to do that for us. We just have to do it.
My name is Nicole Hinkle-Klaus, and I'm the coordinator of the Cardiac Pulmonary Rehab here at Mary Washington Healthcare. We, as a team of exercise physiologists, nursing, and respiratory therapy, work with cardiac and pulmonary patients in their rehabilitation.
They might have had a cardiac catheterization, they might have had a heart attack, they might have been diagnosed with heart failure. And what they do is they help them gradually get back to a better baseline than they used to be.
We not only work on setting them up on a safe exercise program, but we also work with them on their risk factors for heart disease and how to look at each part of those risk factors and manage them on their own. We have a great tool that we use through our Heart Caring organization. The booklet goes through every single step. It's tabbed on the end. The patient can go right to what they want to look at. If they want to look at blood pressure, if they want to look at cholesterol. And it's a great educational tool for them that they can use as they're coming through the program and that they can continue using when they get home. The way that we see how Mary Washington is really committed is our tremendous support from our physicians that believe in us, believe what we do, and they see the improvements in their own patients when they go for that follow-up visit after they've graduated from here. We change the lives of every patient that will walk through this door. The look on a patient's face when they meet every single goal they set for themselves coming in that first day, and they're able to not only meet those goals, but they exceed it way more than what we ever thought.
Our health system exists to improve the health status of our community. I can sit here in front of you today and tell you I know we've done that with heart failure.
My name is Cherie Basso, and I am the Heart Failure Program Coordinator. I was actually hired as a core measures nurse by the hospital back in 2007, and my job was really to go around and review heart failure charts and do some patient education. And what I really found in interacting with the patients and the staff was that we had no real concrete protocols in place. Many of our patients did not know how to manage the chronic illness. Our patients were bouncing back into the hospital after being discharged at an alarming rate. Our 30-day readmission rate back in 2008 was 32.6%, which was well above the national average of 24%.
The education part of it starts the moment they step into the emergency room, all the way to when the stretcher ends on 3 North. We have a multidisciplinary team that comes in to work with the nurses and with the patients. We have a dietitian who comes in, we discuss diets with the patient. We make sure that they have a follow-up appointment within a week with their cardiologist and their primary care physician.
The heart failure clinic is just part of the continuum of care. When they come here, we evaluate their medications, their diet. We go over all those kinds of things. We look for barriers to care, such as transportation or prescription medications. So we kind of look at the whole picture and what's driving some of their readmissions.
When people get out of the hospital, it's like a get out of jail card. I mean, they're happy to be out and free again. And maybe that's the last thing they're thinking about is additional health issues or things we may want them to do. But once they go there and realize it's not a threatening environment, that we're there to help them, and that they do derive a lot of benefit. Maybe they learn some things they hadn't known before that they find that's beneficial. Of course, the proof in the pudding is the fact that they feel better and they're not in the hospital again.
The goal was to see 25 patients in the first year. We exceeded 100 patients within the first few months. So we knew that we had something here. We knew that the volume was out there to serve patients. It's been a big impact for the community.
Sure, we want our hospital beds to be full, but we also want to provide good care. That's really what it's all about. And are you providing good care when a person with heart failure comes back to the hospital 3 times within a month? No, that's not good care. So we've got to make sure that we're providing excellent care to our heart failure patients. And that's what we've done.
And when I meet with the patients one-on-one and I get to talk to them, that really makes me feel good that we've made a difference in the lives of our patients.
Mary Washington Healthcare includes Mary Washington Hospital and Stafford Hospital. And one of the big initiatives that we did over the past couple of years is getting interventional cardiac catheterizations live at Stafford Hospital.
It never dawned on me that I'd be using the hospital, especially the emergency room. Everyone tries to avoid that area, I think. I had pain in my back behind my left arm. It was hard to breathe. My granddaughter, Cameron, came over and she said, "Nana, I know you're not feeling well. Something's wrong." And she said, what do you feel like? What's going on? So I was telling her the symptoms. And at that time, she had been studying the circulatory system at school. She took my hands with tears in her eyes and she said, "Please, tell me you'll go. Promise me you'll go." And I said, "Okay, I'll go. I'll go get checked out. We'll go to school and then I'll go." Well, I dropped her off and I went over to the ER at Stafford. A cardiologist came out of surgery that I didn't know and came in and said, "We've got a new test that we're going to do on you because I think you've had a heart attack." They went in and he put a stent in. There was 90% blockage in one artery, and this was the main artery. And then in the back, there was 60%. I had told him the story earlier in the ER about my granddaughter, and he put his hand on my hand when he was done, and he goes, "You go home tonight and you hug your granddaughter because she saved your life." And we're so fortunate to have that available to us. And Stafford being a new hospital, they've got all the newest in equipment. And, you know, we're so lucky.
We're a nonprofit. We take care of everyone who walks in our doors regardless of the ability to pay. So we have a lot of charity that we do. Some of the outreach that we do within VHVI focuses on health and wellness. So we do events to encourage people to take care of themselves, to be active physically, to eat heart healthy.
To come out a winner, cutting out the salt is what you must do. It's that salt shaker, heartbreaker, life taker, don't you mess around with that salt shaker, heartbreaker.
We have an annual event called Day of Dance that we do in February for Heart Month.
Right foot now, left foot now, y'all. Chop, chop, real smooth. Turn it out. To the left.
Heart disease is by far the #1 killer of both men and women. In fact, it's estimated about 270,000 women will die of heart disease in the United States this year.
That's why it's very important to understand how to take care of yourselves, of course, and what to do if you have signs and symptoms of heart disease.
People come back year after year to our events and tell us how they've improved over time. They talk about changes that they've made. Some of our patients have come back and talked about their relationships with their physicians and how the providers in our healthcare system have changed their lives.
I'm just too busy to have a stroke. Stroke happens to people who aren't busy, people who are ill, people who are older, people who aren't me. I fell to the ground and lost all the feeling on my right side and was unable to speak. In the ambulance, they asked me to grasp their hand with my left hand, which I could do, and they said, grasp with your right hand, and I couldn't, and I remember lifting my hand up and thinking, what is wrong with my hand? And I remember being in the emergency room, and that's when I realized that it must be more serious than I realized. They decided that my stroke was caused by a PFO, which is a patent-formans ovale, which is a congenital hole in my heart, which I had no idea I had. About 2 weeks after my stroke, I went to Dr. Chandra and had a what would have been open heart surgery years ago. Now they use a catheter and they go through your groin. They put a camera down your throat, and he put a mesh covering over the hole in my heart. My name is Andrea McCauley. I am a 43-year-old, very healthy, active mother of 3. I'm a prosecutor. I'm always on the go. And if it weren't for you, I would not be here. I would not be standing. I would not be speaking if it were not for you. Thank you from the bottom of my heart.
The patients really are the reason that we do what we do. When you hear about how you've changed someone's life, how they're able to walk further than they've been able to do in years, that they're becoming pain-free, that they're really getting their life back, in their words, it's extremely rewarding. Mary Washington Healthcare establishing all of these programs, it's not only is it the right thing to do, but it is the right thing for our community, and it shows our commitment to the health of our community in order to keep them well. Way back when, it was just a little house that provided basic nursing care to our community, to now where we're offering the most advanced technology and the latest services and outreach beyond the hospital walls. Mary Washington is the heart of Fredericksburg's healthcare.